Hello. In this online course on tuberculosis for doctors, I am going to talk today about how is tuberculosis affecting public health globally and also nationally. The objective of this particular talk is to help you understand the global and national trends of tuberculosis, to understand the main challenges in tuberculosis prevention and control, to understand the impact the TB epidemic has caused in different parts of the world, and then to understand the principles of end tuberculosis strategy. As you might be aware, it was in the late 19th century in 1882 that Robert Koch discovered the cause of tuberculosis for the first time, and eventually we know that this particular organism called Mycobacterium tuberculosis, we also understood that there are other types of mycobacteria as well that are responsible for causing various types of diseases. But what is more important to understand, that in spite of this knowledge now that we have for more than 140 years, we still are having lots of problems with prevention and control of this particular disease. What is the type of challenge that we are facing all over the world with respect to tuberculosis? Primarily, we have to understand that this disease is reported from all the continents of the world. It is known to affect all the ages and classes of the society. It is closely related primarily to the development and poverty. So, it is more commonly observed among poor and undernourished people. It is known to result into serious economic consequences, and very lately we have also been noticing increased mortality because of this disease due to occurrence of drug resistant tuberculosis bacilli, which is becoming an important public health threat for our country. Which are the diseases we consider as of public health importance? Let us take an example of tuberculosis and understand this really well. Well, because tuberculosis gets transmitted, the bacilli gets transmitted through air, practically every single human being is vulnerable or susceptible to develop the disease. This vulnerability is found to be more in case of impoverished populations and also people who have problems with respect to nutrition, also who are at the age extremes. So, these are the kind of vulnerable populations for tuberculosis. We do face sometimes challenges in the diagnosis of tuberculosis. There is no quick diagnosis available for tuberculosis even today. We know that treatment of the disease, although has been prescribed by the national program very clearly, it can become challenging in complicated cases, particularly when the disease is outside the lungs, where it commonly affects the human body. And as I mentioned earlier, drug resistance which is emerging, deaths associated with drug resistant tuberculosis cases is an alarming problem. Moreover, if we just look at it, many communicable diseases, particularly viral diseases, now have a vaccine to prevent the disease, but sadly we do not have a vaccine against tuberculosis today. If we just look at this particular map, basically it talks about the fact that there are in the last year 2016, nearly 10.4 million new TB cases were estimated all over the world, but what is important to understand is of these 6.3 million cases were notified. What it really means is there is a gap in what is estimated for a particular region and what gets notified. And what you can understand is if you just look at the green areas on the graph, wherever the gap is more, this particular problem is shown as a larger area. If we look at the global scenario of tuberculosis, as I mentioned to you, there are estimated more than 10 million tuberculosis patients as in 2016. More than 90% of these have been found to be or estimated to be adults, predominantly males 65%, and of these nearly 10% are HIV co-infected. So, what is important to understand is this HIV tuberculosis co-infection is a major public health importance problem. Globally, TB is believed to be the 9th leading cause of death, ranking above HIV AIDS, and there are estimated 1.9 million TB deaths among HIV negative people and nearly 374,000 deaths among HIV positive people. So, these two epidemics of HIV and tuberculosis are quite closely linked to each other. As I mentioned earlier, that there are some types of vulnerable populations wherein rates of tuberculosis or chances of tuberculosis are found to be more compared to the others. For example, poor populations residing in crowded locations have a higher risk of acquiring tuberculosis. Then HIV infected people, those who are having malnutrition, those who use alcohol or drugs extensively, and those who are diabetics also have a higher risk of tuberculosis. Women and children in particular are again more vulnerable to tuberculosis, and unique situations where there are a lot of migrant people, there are destabilized populations due to wars and natural disasters, refugees, etc., they also face higher risk of acquiring tuberculosis. This particular graph, I would like you to pay specific attention to the colors which are shown over here. What this shows basically is wherever there is lighter color, the number of children affected in those areas compared to the adults is small, but where you see darker areas, the proportion of children to adults in among the TB affected is very dark, is much more. So, you can see in the regions of Africa, in the regions of Southeast Asia, we definitely have more and more children who are contributing to this big disease burden of tuberculosis, thereby meaning that it is not only the adults that we need to focus on for TB prevention strategies, but we need to also focus on children as well. If we just look at the global burden, the red piece here or the red part of the pie that we see here is what India is contributing to the global disease burden, and as you can see it is nearly 1/5 of the total global burden, followed by China, Indonesia, Nigeria and South Africa, and together these 5 countries contribute to something like 51% of the total tuberculosis incidence disease burden. I need to explain to you, incidence means new cases of tuberculosis. So, these 5 countries are the most which are contributing to nearly half of the new cases that are happening or appearing all over the world. There is a challenge which is emerging because of this problem of drug resistance tuberculosis. Multi-drug resistance of tuberculosis is the primary stage where the patients develop resistance to one or more drugs, 1 or 2 primary line drugs which are used in the treatment of tuberculosis. Here the problem is the patients have to be shifted to the second line of treatment, which the drugs are, where the drugs are more toxic, they have more side effects, they are costly, and the treatment is much lengthier compared to the primary drug regimen. So, that itself is a problem, but that gets further complicated if patients develop extensively drug resistance tuberculosis, abbreviated as XDR, and total drug resistance tuberculosis as TDR. As you can imagine, they just take away all the weaponry that we have available to treat tuberculosis, and that is the reason why death rates following the development of XDR TB or TDR TB are quite huge, and they are rising globally. That is a point of great concern. But what we have to understand, that drug resistant tuberculosis mainly occurs as a result of inadequate TB care, inappropriate consumption of drugs and irrational use of drugs. So, some of these factors are related to the patients, some of these factors are related to the treating physicians, and hence we as treating physicians have a much greater responsibilities here. This slide is just to show you that the whole world, if we just see today, that there are 84 countries in the world that have reported at least one XDR TB or extensively drug resistant case of tuberculosis, and of these 9% are MDR cases as well. What is important to understand, that all those areas that are non-red, it is not necessary that they do not have cases of multi-drug resistant tuberculosis. Probably this is where they are not looking for cases of multi-drug resistant tuberculosis at this point of time, and no reliable data is available from this country. The take home message is multi-drug resistance and extensive drug resistance both are common, and they have now appearing all around us. If we just look at this burden here, globally it has been estimated that there would be nearly 600,000 drug resistant cases. Of these, nearly 500,000 could be due to MDR TB or multi drug resistant tuberculosis. Nearly 110,000 of these have rifampicin resistant tuberculosis. This is a point of great concern again, because rifampicin is the most important drug in the treatment of tuberculosis today, and nearly 240,000 deaths occur in this particular population. What is again most important to see here in this map on the right side of the screen is, you look at the portions of China, look at the portions of Federation of Russia and India. They constitute to something like 47% of the total cases of drug resistance reported from different parts of the country. So, that is something which we have to clearly understand. The problem is very much there and we have to face it head on. If we just look at what is happening in our own country, some of these reports which are flashing on the screen just talk about the fact how people have noticed in Mumbai large number of cases of even total drug resistance against tuberculosis. People are worried. People in public health, people as program managers and policymakers are very worried, because these are the cases we probably are never going to cure. So, it really is important for us that we do not let people go to this particular stage and we do not allow MDR, XDR or TDR to develop at all. If we just look at the burden of tuberculosis in our own country as it is seen in the year of 2016, nearly 2.8 million TB infected people are estimated to be there in India, with a rate of nearly 211 per 100,000 population. And among those, if we just look at the resistance, rifampicin resistant TB cases, they amount to 11 per 100,000. The death rates, or which includes HIV plus TB infections, is close to 32 per 100,000, and mortality due to HIV and TB together is 0.92 per 100,000. So, basically all these figures do indicate very clearly that this is a very serious problem in our country. If we just look at the India map here, and if you also look at the table on the right side simultaneously, what it primarily brings out is the fact that the North India and Western India, where the rates per 100,000 population per year, it is the occurrence of new TB cases. In Northern India and in Western India, the rates are high, and in Eastern zone and Southern zone they are also high, but not as high as the northern and western regions, but the gap seems to be very narrow, and we have to therefore can't very clearly distinguish between the different regions of India as far as tuberculosis is concerned, and we have to consider the overall heavy epidemic going on in different parts of the country. As far as the sex ratio is concerned, the males are more commonly diagnosed with tuberculosis than females, but we have to understand that access to care for women in our country is a huge problem, and that may be one reason why we are seeing less number of cases diagnosed in women. Regarding the various trends that we see, this is the graph on the lower side shows various trends over a period of time. The new cases which are getting diagnosed steadily increasing over the last 15 years or so. The drug resistance slightly going down in the recent times. This is what we observed, but we have this data which is available only in scanty populations, not a full countrywide data. Talking about the burden of the disease, if we just look at the economic burden and the social burden that this disease causes on us, it causes tremendous indirect and direct costs to the society. The indirect costs are believed to be 3 billion, but the direct costs are 100 times that of the indirect cost, which is close to 300 million US dollars. It is so very difficult to calculate how that will get converted into Indian rupees. Just a phenomenal money which is being spent by people who are affected with tuberculosis, and that is one of the reasons. One of the reasons for that is the lack of productivity, which you can see here. Actually, many people, because of the illness, are not able to work and earn money, and that is the reason why there is a lot of out of pocket expense also happening as a part of the disease. Generally, poverty sets in. If this happens in children, you can also see that there are school dropouts, which are and that they are not necessarily due to tuberculosis in children alone, but maybe due to parental TB also, and that contributes a lot. Also, sometimes women face rejection from their own families after they suffer from tuberculosis, and these instances are also pretty high. So, in general, there seems to be a lot of stigma attached to this particular thing. There is a huge economic burden which is caused because of that, and huge amount of out of pocket expenses. If we look at various dimensions of this particular impact the disease is causing on human beings, if we talk about the social impact, I already talked about the social rejection part of it, how mental health of people who are suffering from tuberculosis gets affected. Sometimes the treatment can be very challenging, drug side effects become unmanageable, and that is when frustration sets in and people start getting mentally affected here, particularly when they do not get required family support, and that is why even sometimes psychological issues like anxiety and depression also set in. This highlights the need for a tremendous family support as well as additional counseling support from professional agencies. Not only the social impact, but TB also has a huge medical impact as well. These people do suffer from chronic obstructive pulmonary disease in nearly 62% of the patients, lung fibrosis in 54% of the patients, emphysema in 56%, bronchiectasis 40%. All these are difficult chronic diseases, very hard to control, very hard to treat. Also there is a risk of lung cancer. So, together, in addition to social and long term medical complication, there is a economic impact as well due to loss of productivity, and this in some countries with very high TB burden, even the gross domestic product of those countries has gone down. I did mention that out of pocket expenditure also is an important reason why there are why it leads to poverty. With all this, at the global level, some thinking happened when people started acting or deciding to act very rigorously, and that is how this end tuberculosis strategy got developed. So, this is a strategy where the targets that have been decided for the year 2035, they include 95% reduction in deaths due to tuberculosis, 90% reduction in TB incidence, that is the new cases occurring due to tuberculosis, and no families to suffer from catastrophic expenses. These are difficult targets, extremely difficult targets, particularly from the growing economies or middle income countries, lower income countries. And the strategies that basically form the core to achieve this include an integrated approach for care and prevention. It also suggests that some bold policies and decisions need to be taken. Systemic improvement is really required. In addition to that, research and innovation should focus on bringing in new tools which are diagnostic tools, treatment options, also prevention options like vaccines. In addition to that, various strategies that are available with us, they need to be also advanced in a systematic way. Directly observed therapy supervised is the mainstay of TB treatment, as all of us are aware, that needs to be expanded. Then we have to address the problem of tuberculosis and HIV co-infection as well as MDR, XDR, and separately and more aggressively. We have to strengthen our health systems to diagnose the cases as early as possible, minimize the delays in putting people on treatment, ensuring that the people adhere to the treatment and not lost to the treatment and get the referral care as and when necessary. So, it will be important to engage all kinds of care providers including the private sector, and we have to also empower people with tuberculosis and communities. So, generally to and make an enabling environment which will promote research on tuberculosis, which will bring in new tools and treatment options. So, talking about India, we have set a target of TB elimination by 2025. We know that despite all our efforts that we have been doing, TB continues to pose a very formidable challenge for all of us and to the whole public health systems in general. There are large number of social determinants which drive this particular epidemic in India, including poverty, overcrowding, lack of adequate housing, malnutrition, etc., and they have to be addressed for effective control and prevention as well. The patient support needs strengthening as well. Basically, the out of pocket expenses which families have to spend, these are both for the drugs, for the loss of income, as well as the nutritional aspects. Some provisions need to be made to support these families, and we need to also expand our diagnosis and treatment network with services being made available with newer tools and strategies. Needless to say, we as physicians have to make ourselves very well aware of this particular challenge of tuberculosis, and we have to play the key role as much in this whole national endeavor of TB elimination. Thank you very much for your attention.